back to Body Beautiful. I'm Janelle Marie, and I'm here with Dr. Joseph Mealy, and we are taking your calls, answering your questions, anything you need to know on plastic surgery. You've got the phone number 415-561-8753, and we'll also be giving you Dr. Mealy's phone number later on in the program, so get ready to take that down. Once again, any advice we give you today, you want to consult your own physician. All right, let's talk breast augmentation. Okay. What is it? I mean, what is breast aug? Does that mean enlarged breasts? Does that mean fixing the breast, lifting what?
It can. I guess technically augmentation just means making it larger, but I like to think of it as breast enhancement. So we're making the breast larger, and a good percentage of the time we're also doing lifts or something else to help change the shape of the breast.
Right,
Because breast skin can get loose. Especially like after having babies or weight loss, the skin will stretch as the breast stretches, and even though the breast volume will go away as we lose weight, the extra skin doesn't. And so a lot of times we're having to do a lift to smooth that out. And sometimes people are just born with breasts that don't match very well.
Yeah, that's true. So you can make them symmetrical.
So we try to make them more even.
Oh, I like that. All right, so who's a good candidate for breast aug? Because, you know, a lot of people have a natural sag in their breast and actually looks good. So who's a good candidate?
Obviously, someone who's not happy with their breasts. You don't just walk down the street and say, you're a good candidate. That would be probably bad.
Probably not good.
But it's someone who's not happy with the size of the breast. Perhaps they were a little bit larger before and they've lost that volume, they want to get it back, or perhaps they were always small and have trouble finding clothes that fit, that they may have clothing that fits their hips well but is going to be loose up top, or vice versa. It fits their breasts well but it's too tight in the hip. So it's a lot of times getting the body into balance.
All right, let's go to a phone call, shall we? Because we are talking about breasts. Liz from San Jose. Liz, are you there?
Yes.
Hi, Liz. Thank you for joining us.
Hi.
You're talking to Dr. Joseph Mealy. What's your question?
Yes, I have a question. I have a problem, the opposite problem. I have large breasts.
Oh, okay.
I wear double D, sometimes triple D.
Gotcha.
And I'm getting older. I'm 48 years old, and my back is hurting a lot.
Okay.
And I'm only 5'4", and I've lost some weight, but my breasts seem not to go down. They're still large, and it's just such a tiring thing because I'm hunching now, and
well, the breasts kind of have a mind of their own. They're programmed to be a certain size, and sometimes weight loss doesn't help, which is interesting because a lot of times insurance will cover breast reduction surgery, especially when you're having pain that could be helped by that. The typical pain that's helped is more sort of the lower part of the neck, upper part of the back. If it's the lower back, it may not help as much. But often the insurance companies will require people to lose weight, go through physical therapy, which is not frequently helpful. But what I have found is after breast reduction, often women will lose weight. And I don't know if that's just because their body, they're getting back into proportion, or there's something hormonal. But it seems like often after breast reduction, women do lose weight.
But that sounds, she's only 5'4".
Yeah, no, it makes it so much harder because, you know, it's up to the frame to support everything.
And she said she's hunching, too.
Yeah.
So that's
and if it's happening now, it's just going to happen more and more as she gets older.
Let's take some before and after pictures here. First one, talking about breast augmentation. Dr. Joseph Mealy, what you got there?
So this is someone who came in with a nice shape of the breast, really not needing a lift or anything. And all I've done is just add volume. It just makes it very simple, and that's the only thing we're trying to change, because that's essentially what an implant does, is add volume.
That's perfect, because she didn't, you know, wasn't too bad. Next picture.
So here's someone who was always small and just wanted something to match the rest of her body. And she's not trying to make a statement. She's not certainly what I would call entertainer size. You know, sometimes people want to be really large.
That's a nice size.
Often people want to be an average size. And this is someone who also could go to Victoria's Secrets and be told they're a double D.
That's true. Oh,
so that's why it makes my life hard, because it depends on who's probably buying what style it is.
Bring in the bra.
But again, nice shape, a little bit of asymmetry beforehand. I think we've made it better.
You know, Kate Hudson, Taylor Swift apparently got a small implant.
Yeah.
Because they didn't have much.
Nice.
It looks very good. Last picture, I just had to bring that up.
Thank you. And here's someone who's just lost a lot of volume, especially in the upper pole.
Definitely.
And the breast is a little bit saggy. It's actually dropped down a little bit. And in these cases where it's the whole breast that's descended, but the nipple's still out in front, augmentation also works well for that, because it adds some support.
So that's good. So you didn't really have to take the nipple off in any of those, correct?
No. And then we never do. When we do lifts, we never take the nipple off.
Oh, really?
That would be very, very rare.
Was that the old procedure? Because I do remember some friends getting the T-scars. Really?
It's a common misconception. Even with the T-scar, the nipple is attached to the breast tissue still, but the breast tissue, the nipple, everything is moved up as one unit, and then all their neighbors change because we've removed the skin from the lower part, and that's why we get the scars from removing the skin.
Got to go, but real quick, recovery time on breast aug.
Usually
Not too
breast
bad.
augmentation in a week, people are back doing what they need to do.
Not bad at all. I like that a lot. All right, if you want more information about Dr. Mealy, you can give him a call, 925-943-6353, or check him out on the web, drmealy.com, or you can go to sanfranciscobreast.com. Lots more coming up, and remember the phone number. Give us some calls, anything you want to talk to the doctor about, 415-561-8753. We will be right back.